The diagnosis of brucellosis should include a thorough history, including occupation, travel, exposure to host animals, living conditions, dietary habits, prior infections, and treatments for brucellosis. Serologic tests, including serum agglutination and ELISA assays, are most commonly used in diagnosis of brucellosis. Serum agglutination is considered diagnostic if titers are 1 to 160 or higher in endemic regions, and 1 to 80 or higher in non-endemic regions, or if there's a 4-fold or more rise in serum titers obtained 2 weeks apart. Serologic testing can be done rapidly with high sensitivity and specificity, but with the following caveats. It may be difficult to interpret the result in endemic areas where there's a high prevalence of antibodies against brucellosis among the asymptomatic population. Moreover, false positives have been noted due to cross-reactivity to other bacteria, including Francisella tularensis, Salmonella, Yersinia, Vibrio cholera, among others. Definitive diagnosis of brucellosis can be established based on culture of blood, bone marrow, tissue, and/or other body fluids. In fact, bone marrow culture is considered the gold standard. Unfortunately, these techniques are time-consuming and not sensitive, given the fastidious and slow-growing nature of the organism. Moreover, these techniques would place laboratory workers at increased risk of acquiring the infection. Due to the ease of aerosol transmission, any potential Brucella specimens must be handled under a biohazard hood. The sensitivity of blood cultures with modern techniques is approximately 60%. Subcultures are still advised for a minimum of 4 weeks. Thus, if brucellosis is suspected, the laboratory should be alerted to keep the cultures for 3 to 4 weeks. Because the reticuloendothelial system holds a high concentration of Brucella, bone marrow culture is thought to have the highest yield of revealing the microorganism, ranging from 80 to 90%. Any fluid, for example synovial fluid, pleural fluid, or cerebrospinal fluid, can be cultured, but the yield is usually low. Polymerase chain reaction, PCR tests, have been developed for the detection and rapid diagnosis of Brucella species in human blood specimens.